d'électricité, d'éducation. Il ne saurait accepter de souffrir mieux au quotidien.
Good afternoon, ladies and gentlemen. We're glad you joined us on this edition of your program You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Esia Luciliengu. In Cameroon, approximately 11.2% of the population are living with hepatitis B. Reports indicate that several factors have contributed to this increase, including lack of awareness about the disease, among other factors. Today we'll be looking at what hepatitis B is all about, how it is, the causes, the prevention, and why not, and with a medical doctor. But before I introduce our guest for the day, I have the honor to introduce my co-host, Immaculate Fogwe. Good afternoon.
Good afternoon to you, Lucy. Good afternoon to all our millions of listeners and, of course, televiewers. It's always a pleasure being with you here.
Thank you. Always a pleasure, like you mentioned. And in the studio already is our guest. Our special guest for the day is not a person, Dr. METEN Elvis. Good afternoon, doctor.
Good afternoon.
It is a pleasure having you on Equinoxe Television and Radio.
My pleasure.
And straight away, without any waste of time, we'll begin with the first question, which is, can you explain to us what hepatitis B is all about, the mode of transmission?
Yeah, hepatitis B. First, we want to understand what is hepatitis, which denotes inflammation of the liver. Hepatitis B, because the inflammation of that liver is as a result of a virus, which we call the hepatitis B virus. And this is an infection that several persons are not aware about it. You rightly made mention of the fact that the prevalence is around 11.2%. It's around 11.2%, which is a serious problem. And how can we come across this infection? There are several routes, which firstly, we have blood transmission. Blood transmission in the advent in which people who abuse drugs. They can use syringes, contaminated syringes. With that, you can be infected with hepatitis B virus. We have mother-to-child transmission, that is perinatal route. Reason why during ANC for pregnant women, hepatitis B screening is systematic to be able to curb on this infection. We have sexual route, we have kissing as well. You can be exposed to hepatitis B. Having unprotected sex with someone who is contaminated as well, you can equally contract hepatitis B.
What are some of those symptoms which are associated to this health condition?
Hepatitis B infection doesn't have pathognomonic symptoms, but you have some symptoms that can actually give you an idea for you to suspect that this patient could be suffering from hepatitis B. For instance, we have this culture of always going over the counter medications. Whenever we have my flu, we go over the counter. We have headache or some malaise, we go over the counter and we're like, okay, we have cough, we need some drugs. We have malaria, give us malaria drugs. But it will be shocking to know that some of the symptoms that do manifest in the advent of hepatitis B infection are similar to those of malaria. For instance, we have joint pains, we can have abdominal pains, we have low-grade fever, we can have jaundice or discolored urine. These are all signs that are equally very closely linked to malaria. But most of the times we pass across it because we always think that everything that has got to do with joint pains or with fever, it's malaria, which is not necessarily the case.
How is this condition diagnosed?
Yeah, for diagnosis, generally you go for your screening, hepatitis B surface antigen screening, which is quite advised for all of us to always know our status. And if you know that status, it doesn't just suffice for you to know, it is good for you to go for the preventive measure, which is your vaccine. Now you'll go for your screening, the sero screening. They're going to collect your blood and then they'll screen for the hepatitis B.
What other health conditions could arise as a result of suffering with this condition known as hepatitis B?
Those are the complications of hepatitis B infection. Yes, it is worth noting that not everybody who has hepatitis B today will automatically have that condition again after 6 months, which is actually the cutoff for us to define which case is acute hepatitis B infection and chronic hepatitis B infection. It is worth noting that if we have 10 persons who are infected with hepatitis B infection today, after 6 months, you have at least 90% who have a spontaneous recovery. That is, your system by itself is going to clear the virus away. But however, you have at least 5% that are going to get into the chronic stage. Yes, that is after 6 months. So with that case, the hepatitis, with the hepatitis B, the acute phase, you can have your general measures that will be managed. Yes, but if they have the chronic phase, that is when you have now to go for further lab investigations, where they are going to do like a fibro scan, that now evaluate to see if your liver is getting fibrous. Fibrosis simply means the tissues of the liver start getting hardened, and as such, it loses its function. Like one of the principal functions of the liver is detoxification. So as such, that liver now will no longer be able to perform its role optimally. Then we can talk of liver cirrhosis, and later on, liver cancer, hepatocellular cancer.
Email contacts for those who like to participate.
Yeah, for those who like to participate on today's edition of the program, you had a contact 670-547049. I repeat, 670-547049 or 656-622222. 656-622222.
And now back to you, Doctor. You are a specialist in this domain when we talk about hepatitis B. And Cameroon joins the international community each year on July 28 to observe this day. So we would like to find out from you, in our own context in Cameroon, how frequent is this health condition?
Hepatitis B, it's quite a frequent condition. Yes, we're talking of a prevalence of at least 8% as per WHO by 2015. The statistics we have, but it is equally worth noting that that percentage is even more, because when we talk about there's a study that was carried out by now Professor Cole and collaborators, who is a hepatologist. Yes, that study was carried at Newbell, and it gave us a prevalence among those who are in prison. It gave a prevalence of 12.9%, which therefore means for every 100 citizens or 100 of those persons incarcerated, you have at least 12 to 13 persons who are infected with this virus. So it's something quite common, but we don't know about it because we've not searched for it. And in that case, I told you 90% they get spontaneous recovery upon exposure within 6 months. So if I had it and I didn't go for checkup and I treated myself for malaria thinking it was malaria, at the end of it all, I will get recovery, and I wouldn't have even known that I was exposed to the virus. So with this, we have to be very careful. It is very much common. How many persons do we meet in the course of the day? If we take each and every one of us, we don't come in contact with less than 10 or 20 persons in a day.
Exactly.
And at least there could be one.
I think we have a call on the line. We'll come back to you. Hello? Can you please turn off your receiver before calling? Can you turn off your TV or radio sets?
No, I want
Please turn off your TV or radio set. And we just lost that caller. Please, if you'd like to participate on today's edition of the program, make sure your TV or radio set is turned off, so in order to ease communication, because when it's on, we are unable to get you clearly.
Yeah, Doctor, we were talking about the statistics when it comes to Cameroon. I don't know if you are done with that already.
Yeah, kind of. Yeah,
Okay, now let's get to the management. Before we were talking about the campaign, which is general, which Cameroon is implementing. Individually, how can we manage this health condition?
Individually, I will always say preventive care is better and cheaper than curative. It is very important for you to know your hepatitis status. That is the first thing. Now, once That status
We
is...
have another
The
call on the
recovery
line. Hello?
from hepatitis B, that 90% can be through a natural cause.
So we
I
didn't
wish
get
to
you.
find out whether there is a particular food that a patient who is already contaminated can eat, or how to the natural recovery come about.
Did you get that question?
We didn't get
Can you
you.
still
Reframe the question.
Yeah.
My question is this. In the course of your explanation, you said when a person is already infected with hepatitis B, the possibility is that those who are infected, they can get recovered from the disease through a natural process. And then 5% can be through consultation, or 5% is those who are already having good stage, and then we make the assistance of the doctor. I need to find out the recovery process which is natural. Do you have a specific food or something you can advise somebody to be doing or be eating in order to have that natural recovery?
Thank you very much for the question.
Natural remedies.
Yeah. Yes, and that is where there is a little mix-up, because some persons, they say they can treat hepatitis B. And I want to think they are hiding behind the statistics of the possibility of you having a spontaneous recovery with or without medications. Reason why, once you're exposed to hepatitis, further lab investigations are done. Are you developing your antibodies against that hepatitis or not? Is there an active replication of that virus or not? Is the liver function okay or not? That will now depend, that will now give us the basis on which you could be placed on medications or not, or strictly observation. At times, it's second point, most at times it's difficult to be able to trace exactly when you were exposed to that virus. Because if I know exactly when you're exposed to that virus, I will leave you and I'll say, okay, let's observe. Within 6 months, most likely you could resolve from that. But we can't take that chances because we're working on human beings.
Exactly.
So once you're tested positive, it is very imperative for us to do further lab investigations. And once that is, it's observed that that virus is not actively replicating, or one or two other conditions, you could replace now just on lifestyle modifications. Now, things like hepatotoxic drugs, for instance, like the paracetamol that we take, if you abuse it, it is hepatotoxic. It destroys the liver. Now, alcohol, you will not have to take alcohol. You need to eat healthily. You need to avoid fatty food, all these junk food. You need to avoid them. A lot of hydration, a lot of vegetables, a lot of fruit, and a lot of physical exercises. That will all go a long way to boost your immunity in combating the virus.
All right, briefly, how can campaigns help us? Because we're talking about awareness here, for people to be aware that they are sick, they have this particular condition. How can campaigns then help this?
Campaigns, they play a vital role in preventive health care. It is better to know your health status and you manage it than being ignorant of it and you're dying. With campaign, it is for us to know that status. What is my hepatitis B status? And always take the bull by its horns. Don't be scared. There are people who may have even worse conditions than you think. So it's good you go to any hospital, get your hepatitis B status screening known. Once it's known, if it's negative, I will advise that you systematically go for your vaccine. And that vaccine, you can have 3 shots. And once you have the 3 shots, it can help you for as long as. So with that, campaign comes to bridge that gap, raising our awareness. And once people awareness is raised as far as this health challenge is concerned, what are the measures they can take?
Ima, any last question for Go?
No, I think it's already time. Our technicians are already telling us.
Yeah, thank you very much, Dr. METEN Elvis, for being our guest today and for honoring our invitation.
Thank you.
We'll be having you next time again, sure.
Definitely.
Thank you so much, Immaculate Fogwe.
It was a pleasure being here. Thank you to Doctor.
Pleasure, Shane.
All right, for presentation, I have been Sia Lucy Liengo. At the technical dashboard, we had Jonathan Babiola and Louis Pego. We live in the company of interesting programs on Equinoxe Radio Show, of course, television. Bye-bye for now.